An intact mucosa requires access to fermentable fiber, a minimum of 15 grams a day if possible, 30 grams a day, but often we have to stay with 5 grams or so. If the body is not supplied with fiber, for some time bacteria can make fiber, or bacteria use for fermentation mucin or other substrates available. But long term, it's necessary to provide fiber from the outside. Okay, I go back then. It also needs fermenting bacteria. It's no use to bring fiber to the colon if we have killed the fermenting bacteria by antibiotics, or if the disease has eliminated the flora. And I'm now not talking about regular lactobacilla which can ferment milk. That's something else. There are thousands different lactobacilla in the human intestine. I'm speaking about those previously not explored who can ferment, or which can ferment fiber. When fermenting bacteria and fiber meet in the colon, they produce short-chain fatty acids, which is the main fuel for the colonic mucosa. And I'm going to mention more about these short-chain fatty acids during the evening. The process of fermentation in the colon has 3 goals. It produces nutrients for the intestine, but also for the liver and other organs, but mainly and most important for the intestine. They eliminate toxic substances. A lot of toxic substances are destroyed in the colon and eliminated. Also nutrients of less value. There are bacteria which destroys cholesterol and can significantly reduce blood cholesterol in patients. And you know from the experience here, when they had oil in the Gulf, they came with bacteria which could destroy the oil. This sort of mechanisms are frequently used in our body, and we should look after that we have the right type of bacteria to produce that sort of work. It regulates the body metabolism, and also lactobacilla per se has the capacity of stimulating the immune defense of the body. So what's happening is that non-starch polysaccharides, digestion-resistant polysaccharides, and simple carbohydrates that escape absorption in the stomach and the small intestine, they reach the large intestine. They are fermented to produce acetate, propionate, and butyrate. Acetate is metabolized to glutamate and aspartate, and especially glutamate is the strongest membrane barrier protector we know. And the pharmaceutical industry is today paying millions and millions to try to produce good drugs, good solutions for supply of glutamate to our patients. A professor at one of the 5 universities in Philadelphia with the name of Rombo, he has written a big textbook on nutrition. He did 2 or 3 years ago an interesting study. He made colonic anastomosis in rats, and he supplied them with short-chain fatty acids. And he could see that the intestine was stronger in those getting short-chain fatty acids. The bursting strength was higher, was better. You know, if it blew up the intestine, it took higher pressure before it bursted. You can see this here, that this is the treated group compared to the controls. If so, then we should, in connection with colonic surgery, no more keep our patients starving, because supply of short-chain fatty acids is important, and the best supply is to have it produced locally. He further was able to show that this was not anything but a real regeneration. He measured the mucosal DNA, you see here, and this is a short-chain fatty acid treated group, and you see that the DNA content was much higher, indicating a true regeneration in the colon as a result of a supply of short-chain fatty acids. If this is so in a surgical anastomosis, it's also so if we have got atrophy of the colonic mucosa for other reasons. Dr. Bengt Jeppsson and I and some other doctors, professor of microbiology and or several professors of microbiology, of food nutrition, etc., we decided some years ago to form a cooperative to look at these things. We did collect lactobacilli from the human intestine. When this slide was produced, we had 200. We had today recognized more than 1,000. And we can give them names according to their DNA code, and we can study the ability of each of the bacteria to ferment fiber and to counteract sepsis. Of course, this is a tedious work, and nobody can do that in one man's life. So we had to make some shortcuts and study groups, and we have done that. We decided to produce a new nutrient for patients based on fermentation in a vessel of fiber outside the body, and then give the patients a fiber containing nutrient with lactobacilli. And we produced, if you may accept the word, an oat yogurt, which contains 100 times of lactobacilli than any milk yogurt produced. But furthermore, which contains human lactobacilli, which milk yogurt does not, fiber fermenting lactobacilli, which milk yogurt does not, and lactobacilli which can pass the stomach with a high pH, etc. Oat is an interesting food because it is extremely rich in amino acids with a very similar pattern as the human muscle. It is further rich in fiber, especially liquid fiber, beta-glucans. But what's most interesting is that it contains a lot of mucosa-protecting phospholipids, mucosa conditioners, 100 times more than any other food where we live. Competing foods are the green banana, or the banana in general, the potato banana, the plantain, and the oat, and the soya bean. But we decided to go for the oat. We tried a series of lactobacilli to find the best. We said that these bacteria should ferment well, they should be able to survive at the pH of 1 during 30 minutes, corresponding to the environment of the stomach. They should be able to survive in bile acids, corresponding to the environment of the small intestine, and they should settle down at the colonic mucosa and work when supplied from the outside. This is an old slide. We have now tested, as I said, thousands. And we have found some interesting ones. We have done extensive studies in rats where we have replaced treatment with antibiotics as prophylaxis and instead use